aplastic anemia due to the presence of large abnormal red blood cell megaloblastocysts in the bone marrow. Number 2, vitamin B12 deficiency results in macrocytic anemia and neurological disorder. And explanation: vitamin B12 is crucial for DNA synthesis and maintaining healthy nerve cells. A deficiency in vitamin B12 can cause macrocytic anemia and neurological disorder, which might include symptoms such as numbness, tingling, muscle weakness, and problems with balance. And number 3, the cause of vitamin B12 deficiency is gastrectomy. A gastrectomy, or the surgical removal of part of the out of the stomach, can lead to vitamin B12 deficiency. The stomach produces intrinsic factor, which is essential for the absorption of vitamin B12 in the small intestine. The absence or reduction of intrinsic factor production due to gastrectomy can impair vitamin B12 absorption, leading to deficiency. So summarize what I have said.
Discussed 3 key aspects of vitamin B12 deficiency. 1. B12 deficiency anemia. It is macrocytic hyperchromic, also known as megaloblastic anemia, characterized by larger than normal red blood cells, macrocytic, with a higher hemoglobin concentration, hyperchromic. 2. Effects of vitamin B12 deficiency. It leads to macrocytic anemia and neurological disorders, including symptoms like numbness, tingling, muscle weakness, and balance problems due to its role in DNA synthesis and nerve cell health. 3. Cause of vitamin B12 deficiency. Gastrectomy can cause a deficiency because the procedure reduces or eliminates the production of intrinsic factor in the stomach, which is crucial for the absorption of vitamin B12 in the small intestine.
Okay, so I'll summarize what you have said. Vitamin B12 deficiency anemia, macrocytic hyperchromic. And vitamin B12 deficiency results in macrocytic anemia and neurological disorders. And the cause of vitamin B12 deficiency is gastrectomy. So let's move on to the next questions. The cause of vitamin B12 deficiency is not by GI bleeding. Alcoholism, red cell antibodies, and gastrectomy can cause the vitamin B12 deficiency, but GI bleeding not cause the vitamin B12 deficiency. And number 2, vitamin B12 malabsorption may not be caused by colon resection, but Crohn's disease with ileum involvement, ileum resection, gastric resection, Addison disease can cause the vitamin B12 malabsorption. And number 3, treatment of vitamin B12 deficiency anemia. Treatment: 2-week intramuscular cobalamin replacement, 1,000 week cobalamin until hemoglobin returns to normal, and folic acid, and 2-week intramuscular cobalamin replacement only. So I will give you some explanation. The cause of vitamin B12 deficiency is not by GI bleeding. While gastrointestinal bleeding can cause the anemia, it does not specifically cause vitamin B12 deficiency. Vitamin B12 deficiency is typically caused by factors that affect the absorption or intake of the vitamins, such as alcoholism, which can damage the stomach lining and the liver. Autoimmune conditions like pernicious anemia that result in the destruction of the red cell antibodies, or surgical procedures like gastrectomy that removes the part of the stomach responsible for producing intrinsic factor, which is essential for vitamin B12 absorption. And number 2, vitamin B12 malabsorption may not be caused by colon resection. Vitamin B12 is absorbed in the ileum, not the colon. Therefore, a resection of the colon should not typically impair B12 absorption unless it somehow affects the ileum or the upstream small intestine. Conditions such as Crohn's disease with ileum involvement, ileum resection, or gastric resection, and certain endocrine conditions like Addison disease can impact the ileum or other parts of the digestive system involved in vitamin B12 absorption, leading to malabsorption of the vitamin. And number 3, treatment of vitamin B12 deficiency anemia. Correct answer is 1,000 week cobalamin until HB returns to normal. Treatment for vitamin B12 deficiency anemia usually involves administration of cobalamin, vitamin B12. This can be given as intramuscular injection, and the frequency can vary depending on the specific needs of patients. A common regimen might be 1,000 micrograms per week until the hemoglobin levels return to normal, followed by monthly injection for life in cases such as pernicious anemia. Folic acid can be used to treat folate deficiency anemia, but it is not a treatment for vitamin B12 deficiency anemia, and if given alone, could potentially mask the anemia caused by vitamin B12 deficiency without addressing the underlying neurological damage. Therefore, option C, all of the above, is not correct because folic acid is not treatment for B12 deficiency anemia. So summarize these 3 questions and answers.
You elaborated on 3 more points about vitamin B12 deficiency. 1. Causes. Excluding GI bleeding. Vitamin B12 deficiency is not caused by gastrointestinal bleeding. Instead, it's typically due to conditions that affect vitamin absorption or intake, such as alcoholism, autoimmune conditions like pernicious anemia, or surgical interventions like gastrectomy. 2. Vitamin B12 malabsorption causes. Vitamin B12 absorption primarily occurs in the ileum, not the colon. So colon resection usually does not impair vitamin B12 absorption. However, conditions affecting the ileum such as Crohn's disease, ileum resection, gastric resection, or Addison's disease can lead to malabsorption. 3. Treatment of vitamin B12 deficiency, anemia. The treatment involves administering cobalamin, vitamin B12, intramuscularly, typically 1,000 micrograms per week until hemoglobin levels normalize. Folic acid is used to treat folate deficiency, but is not suitable for treating vitamin B12 deficiency anemia, as it does not address the neurological symptoms and could mask the anemia symptoms.